Okay, it says we are live on Facebook. So I will introduce us. My name is Mandy and I'm with COVID Recovery Iowa. And COVID Recovery Iowa is a FEMA-funded grant that the state acquired once the pandemic was declared a disaster. And we're here for that extra emotional support that's oftentimes needed in the event of a disaster. And today I have with me Kirby and Aaron from Orchard Place, who are going to be talking with us about inpatient and outpatient mental health services. So we took a poll in our Parenting in a Pandemic group. And one of the things that people wanted to know more information about was, what is inpatient mental health? What does that look like? How do you access it? And how does that differ from outpatient? And how does it kind of all work together? So Kirby and Aaron, you're from Orchard Places, mainly in the Des Moines area. Is that correct?
I can answer that quickly. So we have in our inpatient, which Kirby will talk about, we have kids from all over Iowa. We have youth from all over Iowa. So that's really can be a statewide resource, but there are also other facilities in other parts of Iowa. But that program for us has a reach of statewide because of the children that we serve and the youth we serve, but primarily Polk County for our PACE center, and then a little bit of Warren, a little bit of Dallas, a little bit of Jasper for some programs. And then our child guidance center is in Des Moines, but some parents will come, an hour and a half to bring a child there to access specialty care. So that's a little bit geographically how we're situated.
Okay, so inpatient is located in Des Moines, but serves the whole state of Iowa. And then your PACE facility serves a whole bunch of counties surrounding Des Moines area. And then the Child Guidance Center, you said is specialty care services, specialty mental health care services?
So I'll let Kirby talk a little bit about that, but depending on what the child presents, there may be different therapists that are a really good fit for that based on their background and like Kirby has some certifications that are in a care model that is unique.
Okay. Sounds good. Which one do you want to expand on there, Kirby? Which one can you help us better understand? Maybe start with the inpatient, since that was on our poll. And so how does somebody so I'm from north of Waterloo, how does somebody access the inpatient services there in Des Moines?
Yeah, that's a great question. Thank you, Mandy. We do have a website that anyone can go to and look at, and the application is actually right there on the website. It doesn't require a referral from a provider in order to gain access to our residential facility. And there's also like different kinds of residential care for children's mental health in Iowa. And so our residential facility is what's called a PMIC, PMIC, Psychiatric Medical Institute for Children is what that stands for. And it's a service for residential care. It's 24-hour care. And when a child is at a PMIC, they live there and have their school there. And they have a therapist there. And there's also a psychiatrist there. Iowa actually has 9 PMICs total right now that parents could choose from. And there are differences between each one. And some of them have some specialties and so forth. For example, there's one in Dubuque called Hillcrest that has a specialty in substance use. There's one in Sioux City called Rosecrans, Jackson Recovery, that has a substance use kind of specialty to it. Also a dual diagnosis for adolescents often that are struggling with substance use and mental health. And then there's different age ranges. So for example, our PMIC starts off at age 10. 10 is the youngest, but if someone has a child as young as 5 that needs PMIC, Four Oaks and Mason City takes kids as young as 5. They have a unit there that works with younger kids. So there's a lot of different options and things like that when it comes to choosing which PMIC is the most appropriate. The other inpatient care that people think about would be the hospitalization, and that is definitely a more acute level care. And then there's a couple around here and there that there's like a crisis stabilization sort of level of care there, where a child might go for 2 to 5 days, maybe up to 10 days at a time, for for some crisis stabilization, but those are a little further and spread out, I guess, a little bit. So
Not
yeah,
as easily accessible, maybe, is what it sounds like.
for some, but not for others because of like where it's located. So if you're in Des Moines, there's one at our Easter Seals. It's not too far. If you're in Sioux City, there's one at the Jackson Rosecrans location. That's not too far to get to. So
Okay, so I'm thinking if if 911 was involved, it might result in hospitalization, which I could see how somebody might also refer that as an inpatient because
Yep.
you're probably getting admitted to the hospital. But what you're talking about is a PMIC, which is a longer term care, and it's not
Yep.
just hospitalization. It's an overall care addressing all kinds of mental health needs, is what it sounds like.
So a psychiatric hospitalization would be accessed, like through 911, going into the ER, presenting at the ER saying, oh my gosh, here's my child, we've had this happen. And then they would assess the level of need and either they're going to admit or not. And then the PMIC is more of a, you'd fill out this lengthy application, this social history would be included and so forth. And then it would go before each PMIC has a admissions coordinator and an admissions team that they review those applications and decide if it's an appropriate fit or not. And then they have to get it approved through insurance. And then once that can take several weeks to go through that process, even if there's no wait list, just to get all that kind of homework done, to get everything together, to get that initial auth. And then when the child comes in, they could stay for a couple of months, or sometimes kids are even with us for up to a year. Now that's not as common as it would have been like 20 years ago. We would have kids that stayed at our PMIC for a year. That was pretty common. But anymore, it's like 4 to 6 to 7 months maybe.
Okay. So somebody could go to, I think Erin will share a link that we can put in the comments section after in our Parenting in a Pandemic group. But if somebody wanted to go and look at the application process of what the questions kind of look like, somebody could go and do that without actually submitting it, just to see what that maybe looks like. I'm thinking about is it up to age 18? I guess that's it.
Yep.
Okay.
So if a child is 18, they either would need to be discharged, or we go through another kind of intake process where the child has to sign all of their own paperwork to stay longer than. And we do have kids who feel like, I'm this far in my treatment, I'm not quite done yet, I'd like to finish the program, I'm going to sign myself in, and then they finish our program. So typically 18 is the oldest, but there are some rare times where we'll finish the program out.
So if I was a parent that had a child in need, is it common for a parent to just go and research this and apply that form by themselves? Or what I'm wondering is it also common for them to already have a therapist that kind of helps them and guides them in this process of applying for potential PMIC placement? I'm thinking about that inpatient connection to outpatient mental health.
Yeah, it is, when there is a connection, that can be very helpful. The parent can and probably would need to actually initiate the process, even if there is a therapist. So my suggestion, our admissions team at Orchard Place, if someone's interested in Orchard Place's PMIC, is to just get on the phone and talk to our admissions counselors. There's 3 of them at Orchard Place. They've all worked at Orchard Place for a long, long time, and they will listen to your story. They will be able to say, well, actually, this might be a better fit, or I'm not sure if they're at this level of being able to be approved for this level of care, because there has to be some criteria that would be met for them to meet this level of need. And so then they would give that advice to the parent. They're like care coordinator, case manager folks, and they're great. They give great advice for what the family would need to do, because each situation can be so different. And so that would be a one step. There is this other form that would need to be filled out called the certificate of need, and that's on the application form, but no one needs to fill that out right away. I know it's there, but that form needs to be filled out really after the child's already been approved. But it shows that a doctor and another professional feels that the child meets this level of care. So the child does have to have a pediatrician or a primary care physician or a psychiatrist or somebody that can sign that line
Okay. What I'm thinking about a typical day in a PMIC unit. What does that look like for a child? And for the parent, how are they connected with that? If they lived way up in Little Denver, Iowa is where I'm at. I'm in Waverly, I guess today. But if I lived
Okay.
here and my son or daughter was in the PMIC unit in Des Moines, what does their day look like, and how am I involved in that?
Family connection is very important for any PMIC care and any of the PMICs all over the state, and that's kind of a requirement of the insurance and so forth. But it makes sense. Kids do better in the context of their family's involvement and so forth. So sometimes it doesn't make sense. We're pulling this child out of the family unit, placing them in another city, and so we want to incorporate the family as much as we're able to. And so we would want to make sure that the parent was able to call into the unit as they wanted or as they needed. So the parents are always welcome to call the unit. If it's after 8 o'clock at night, the kids are probably already settling and so forth. But that might be more like they'd want to talk to the staff and get an input on how their child's day went or something. Visits are always recommended. Obviously, we don't want to pull kids out of school and things like that, but there's weekend visits and after school visits. And family therapy is a requirement, and it needs to happen weekly. So if you live in Waverly or Denver, you're driving to Des Moines every single week is possible for some families, but that's also not possible for all families, So there is this thing where you'd want to make sure you could make it at least twice a month, the road trip to Des Moines to make that family therapy. Then the other week it could be done virtually, and it means much like this. We use a program called GoToMeeting that fits all the HIPAA requirements and everything for confidentiality and so forth, whereas Zoom doesn't necessarily fit those requirements. So we would use our platform to do telehealth therapy sessions then with families who might be a distance. Now, a
Okay.
typical day is the kids wake up at, 7 o'clock, and some kids have some morning chores or their routines and so forth, and they go to school around 8:30 after they had breakfast on the unit, and some kids will be doing chores and things like that depending upon their levels and so forth. And school's right on campus. And at our PMIC, the teachers are employed by the Des Moines Public School District, but in other PMICs they might be employed by that city's school district or by the local area education agency. But there are schools on campus and I believe most of the PMICs that I've visited. I'm pretty sure. And now I know, like Four Oaks and Mason City, I know a lot of the kids go to the public school there, where a lot of the Orchard Place kids stay at the campus school. So that's where it would vary between one PMIC to another, how many kids are at the campus school versus the public school. And then they have lunch on their unit with their unit peers, and then they go back to school in the afternoon. And then at 3, they're back upstairs for a snack and afternoon activities. Therapists and psychiatrists might pull kids out of class, but a lot of times those appointments will happen after school, and family therapy would happen at least once a week for each child after school. And then there's a staffing that they'll have every now and then to update the entire team on how things are going.
So we talked a little bit about this. Did you say average stay? It was 4 to 5 months. Did I hear that right?
I think that's about where we're at right now. Yeah.
Okay. Average length of stay. And then how about, I hate to squelch any hopes of this being a useful tool for someone, but we talked about wait times. How, go ahead.
That can vary from time to time. Like all of a sudden, there'll be certain times of the year where it seems like we'll have a lot of discharges. So sometimes it's like right when school year ends, there'll be a lot of discharges, and then we'll get a little wave of new kids in, but not always. So it kind of ebbs and flows. It also depends on the need of the child. So the rooms at our campus they're co-ed units, and most of the kids have a roommate that of course would be the same gender. So like each room has like 2 rooms with a bathroom in between, sort of. That would all be boys, and then this other one over here, that one might all be girls. So we do have them groups by gender, on the units to some degree. But if a child needs a single room, that kid might wait a little bit longer, unfortunately. Just right now there's kind of a demand for single rooms, and there's not as many that we have available. And sometimes age might make a difference. So we have a nice mix of ages. So sometimes younger kids, it might be a longer wait. Also with younger kids, there's fewer PMICs that take younger kids. So there's this supply and demand kind of thing that happens also. So sometimes younger kids have to wait a little bit longer.
Okay. I know, Aaron, I saw another really useful link that you've got that we can put in the comments at the end is about the different locations of all the different PMIC units across the state, which is really helpful. Especially if there is a wait time somewhere and you're looking for something more sooner than later. But you also you pointed out that it can be a several week process getting that approval through the PMIC facility and insurance and just all that paperwork that is necessary to make it happen. So it's not something that's meant to happen tomorrow, right?
Yeah, and unfortunately, a highly aggressive, very high needs, like 10-year-old is going to maybe have like a 5-month wait potentially. And that's a long wait. So that's on the long end of the spectrum, and then a teenager who doesn't have aggression, who can handle having their own room or can handle having a roommate might have, let's say, a 4-week to, a month or so wait.
Okay. And that's Orchard Place, or do you feel like that's representative of all the units?
I think, well, that's Orchard Place, but I also do with my role at PACE. We have our integrated health program at PACE, and PACE is the branch at Orchard Place that has a lot of the community-based in your home kind of services like BHIS and so forth. We also have substance use services there too, where the kids come into our office. But so I do talk with a lot of the PMICs across the state, and so I don't know what all the wait lists are like, but I think it's probably pretty similar to that.
Is there any questions? I forgot. I was so engrossed in the conversation. Is there any questions or comments for Kirby or Aaron today? If you do, feel free to put them in the comments, and if we can't get to the question right now, we can answer them later. But I'm going to check on my phone here too, because I don't see any comments, but it looks like we have 6 people watching live. So I want to make sure I didn't miss any. We're past our time. Do you have anything more to add that you want people to know or think parents should know about your services?
Well, I know there's a lot being said and, in the news and so forth, and there's a push to increase access to services. It is tricky sometimes to access services, but don't give up. Continue to ask. Be a great advocate for your child. I do have my own child. I have my own child has mental health disorder, and my child has been in a PMIC before, and so I know from that standpoint. I mean, it's just staying persistent, continuing to ask, not just accepting no as an answer all the time. If you hear, if you take your child and say, oh, they don't really meet criteria, don't just, and you really feel they do, continue to ask questions and find out, because there is help available, and there are services and things that we can do to help.
Very good. Thank you. Thank you for your information. And Aaron, we look forward to your links that you're going to put in the comments section. We do have one person that leaves us. She says, helpful information. Thanks for doing what you do. So that's a good note to end on. Thanks for taking the time to meet with us today.
Thank you, Mandy.
Take care.